Thank you so much. I'll reintroduce myself. I'm Erin Drinnin. I'm project manager of the Direct Care Workforce Initiative at the Iowa Department of Public Health. And as John said, I'm really here hopefully to provide a little bit of an overview and some background information about the project that you all are here to discuss today. And the panelists will go into a lot more detail, I'm sure, on some of the specifics. But the Direct Care Workforce Initiative is a project that really started many, many years ago. Some folks have referred to the task force and the council. A lot of these efforts actually started, it was probably about 2004 with the Better Jobs, Better Care coalition efforts that happened at the state. The Department of Public Health was a member of that coalition, and that was really kind of the jumping point where folks started to get together and talk about the growing demand for this workforce and really the need for improving recruitment and retention of direct care professionals in the state, and starting to look at this issue of standardizing education for the workforce. As a result of that coalition, a lot of things happened that you've heard people talk about today. So as a result of the work of that coalition, the legislature put into place the Direct Care Worker Task Force initially, that was created to look at how to standardize and streamline educational standards for the entire workforce. So this was where I think Iowa has really been a leader in terms of looking at the workforce as a whole, looking at the entire workforce, all of the settings, all of the different populations and services that direct care professionals provide, and how do we start looking at the education across the entire spectrum and how we could standardize those services, the education that's provided for those services. The task force then evolved into the Direct Care Advisory Council, Direct Care Worker Advisory Council, and that's a council that's in place right now. And that is, Di mentioned, a very diverse group of stakeholders, people who have been working tirelessly on recommendations, ultimately to provide a model for Iowa for developing a high quality and hopefully stable workforce for Iowa. The legislature for several years has been tasking this council with various activities. Most recently in 2010, they were provided with a 2-year charge, and they've been charged with doing several things, including developing estimates of the workforce. Di referred to some of those numbers earlier, reporting on results of a pilot of the training and credentialing recommendations, which I'll go into in just a minute here, doing a lot of outreach and education, like ICA is doing tonight. So starting to share the information with direct care professionals, with individuals who are served by direct care professionals and employers as well about what their recommendations are and what they might mean. Recommending composition of a board of direct care professionals and laying out what those functions would be and what credentials it would oversee. And also providing recommendations for an information management system. So how would this all be managed, and how would we collect information on this workforce through the use of technology? So that's a little bit of history. When we talk about direct care professionals, I think it's important to define it, I guess. Many of you probably know what we mean when we say direct care professionals, but as Di said, it's really meant to be an umbrella term for the workforce. Direct care professionals work in really diverse settings and with lots of different individuals. They work everywhere from home and community-based settings, providing home health, hospice, supported employment, respite services. They work in community residential settings like assisted living and group homes, and they work all the way up into facility settings like nursing homes, hospitals, and intermediate care facilities for individuals with intellectual disabilities. Those are really just a few, but it's meant to kind of show you, hopefully, the real diversity of the workforce and individuals that we're talking about. It is the largest workforce in the state. The new estimates, we are estimating about 75,000 direct care professionals that currently in Iowa. We know that despite it being the largest workforce, that there's an impending shortage. Iowa Workforce Development has estimated that Iowa is facing a shortage of this workforce. That may not be news to many of you in the room as you think about Iowa as a state. We have a growing elderly population, and And you combine that really with a focus of folks really desiring services more in their homes and in community settings of their choice. We really reach that high demand for those services for direct care professionals. In addition to it being a large workforce and in high demand, we know that there's a lot of challenges too. And some folks have mentioned them. Becky talked about the turnover rate. The turnover rate in Iowa is estimated to be 64%. That's a really high turnover rate, and I think turnover happens for a lot of different reasons, but I think what's important is what the impact of turnover is, and that's something that the council's looked at. So we know that when you have high turnover, that leads to a lack of consistency in services. There's a disruption for the individual served in terms of a break in service, a break in that relationship that's been developed with between the direct care professional and the individual receiving services. And ultimately, it costs a lot of money as well. The council is currently updating their numbers, but they've estimated that in 2011, turnover cost employers $189 million in Iowa alone. And a lot of those turnover costs are related to the lack of standards of education. We know that a lot of redundancy in training happens right now in the system. There's a lot of retraining that happens that leads to a lot of high costs. So, because of all of this background and history, the statistics that talk about not only the importance of the workforce, but the challenges related to the workforce, the council, a very diverse group of folks that includes direct care professionals, individuals served by the system, employers, a really diverse group of folks have come up with recommendations that really create a model for providing quality and stable direct care services in Iowa. I'm going to highlight, I'm going to hit the highlights of the recommendations and also kind of where we are in terms of the project at this point. So you've heard some folks already talk about a lot of the recommendations of the council, but there's essentially about 5 major components of the recommendations. They've recommended essential competencies, so basic training that all direct care professionals would need to really assure minimum qualifications within the career of direct care. Statewide educational standards would create portability for folks across services and settings. So again, a lot of the retraining that's happening right now in the system is as individuals move from one setting to another and they're providing a variety of services, there's a lot of retraining that happens. So educational standards to address that. Choice in training format and delivery. We know that training of direct care professionals happens in a variety of ways. People learn in different ways. Training's online, training's in person. It's often highly specialized depending on what it is that direct care professionals are doing. So the council has built in a lot of flexibility in terms of how that training is delivered and in what mode. The heart of their recommendations are really career pathways that provide opportunities for direct care professionals to advance and grow within the career of direct care. So essentially what career pathways mean is really giving people opportunities that would hopefully improve both recruitment and retention in the field. So it would not only make the career of direct care more desirable for people coming into the field, but also hopefully encourage the great direct care professionals that we have to stay in the field because of the additional options for enhanced training and advancement and recognition. Lastly, the additional component that the council has recommended is grandfathering of the current workforce so that individuals who are currently working as direct care professionals would be recognized for the training and skills that they have and would be awarded a credential that essentially matches the work and skills that you have right now. And as has been said, this would all really be overseen and regulated by a board of direct care professionals. That's really the highlights of the recommendations of the council. I think the next question is, what are we doing now? The council's done a lot of really great work providing these recommendations. What the department did was applied for a federal grant to essentially be able to implement the recommendations and move them forward, build some of the infrastructure necessary to be able to keep the project going. So there are some key things that the department is doing. Essentially, all of it really centers around piloting this. So piloting the educational standards, piloting the curriculum, and really testing it out in the field with direct care professionals and Iowans. We are developing competencies and curriculum, and we are piloting that in partnership with several employers and community colleges in 2 regions in the state. And when I say piloting, really those folks are actually delivering the training, and we're getting a lot of feedback and measuring a lot of outcomes related to that. There's also a leadership, retention, and mentoring component that's built in. We know that retention supports and mentoring improve retention and improve job satisfaction, so we have incorporated that into our project as well. A really big piece of our project, too, is developing the information management system that would essentially do 3 things. It would allow for individuals to apply and renew for credentials online. It would also really provide the first ever tool for collecting data on this workforce. The council's made estimates, but we don't have a really good way at this point to collect data on this workforce. And the third thing that it would do would be to provide public access to information about the workforce. This is all really kind of overseen by a state and national level evaluation where we're measuring not only knowledge gained, so is the curriculum and the education standards improving direct care professionals' knowledge, but also looking at things like job satisfaction, retention, costs, and ultimately impact on quality of care.